Histamine H2 blockers attenuate the gastric secretory response to acetylcholine and pentagastrin as well, because acetylcholine and gastrin act partly by releasing histamine in gastric mucosa. For healing duodenal ulcer, the usual duration of H2 blocker therapy is 8 weeks. What is true of acid control therapy with H2 blockers? It generally heals duodenal ulcers faster than gastric ulcers. In the intact animal, H2 receptor antagonist potentiate the following action of antihistamine, that is bronchospasm. Gynecomastia can occur as a side effect of cimetidine. Which histamine H2 blocker has most marked inhibitory effect on microsomal cytochrome P45 enzyme, that is cimetidine? Choose the correct statement about H2 receptor blockers, that they prevent stress ulcers in the stomach. Ranitidine differs from cimetidine in the following respect, that it does not have anti-androgenic action. Compared to H2 blockers, omeprazole affords the following action, that faster relief of ulcer pain, faster healing of duodenal ulcer, higher efficacy in healing reflux esophagitis. Choose the drug which blocks basal as well as stimulated gastric acid secretion without affecting cholinergic, histaminergic or gastrin receptors, that is omeprazole. Omeprazole exerts for practically no other action except inhibition of gastric acid secretion, because it transforms into the active cationic forms only in the acidic pH of the gastric juice. Its active forms have selective affinity for the hydrogen potassium ATPase located in the apical canaliculi of gastric parietal cells. Its cationic forms are unable to diffuse out from the gastric parietal cell canaliculi. The most efficacious drug for inhibiting round-the-clock gastric acid output is omeprazole. The following is true of proton pump inhibitors, except their prolonged use can cause atrophy of gastric mucosa. The first choice drug for non-steroidal anti-inflammatory drug-associated gastric ulcer is omeprazole. Select the drug which is an inhibitor of gastric mucosal proton pump, that is lansoprazole. The following class of gastric anti-secretory drug also reduce gastric motility and have primary effect on juice volume with less marked effect on acid and pepsin content, that is anticholinergics. The primary mechanism by which prostaglandins promote ulcer healing is augmentation of bicarbonate buffered mucus layer covering gastroduodenal mucosa. Choose the anti-ulcer drug that inhibits gastric acid secretion, stimulates gastric acid, mucus and bicarbonate secretion, and has cytoprotective action on gastric mucosa, that is misoprostol. The following statement is true about misoprostol, that it heals non-steroidal anti-inflammatory drug-induced gastric ulcer not responding to H2 blockers. The acid neutralizing capacity of an antacid is governed by the equivalent weight of the antacid and the rate at which the antacid reacts with HCl. As an antacid, sodium bicarbonate has the following disadvantages, except it has low acid neutralizing capacity. The following is true of aluminum hydroxide gel, except it causes loose motions as a side effect. Choose the correct statement about megalrate, that it has a rapid as well as sustained acid neutralizing action. Antacid combination of magnesium and aluminum salts are superior to single component preparations because they have rapid as well as sustained acid neutralizing action. They are less likely to affect gastric emptying, and they are less likely to alter bowel movement. In peptic ulcer, antacids are now primarily used for prompt pain relief. Sucralfate promotes healing of duodenal ulcer by coating the ulcer and preventing the action of acid pepsin on ulcer base. Antacids administered concurrently reduce efficacy of the following antipeptic ulcer drug, that is sucralfate. The following anti-ulcer drug does not act by reducing the secretion of or neutralizing gastric acid, that is sucralfate. The most important drawback of sucralfate in the treatment of duodenal ulcer is need for taking a big tablet 4 times a day. Choose the correct statement of colloidal bismuth subcitrate, that it has anti-H. pylori activity. Eradication of H. pylori along with gastric anti-secretory drugs affords the following benefits, that is faster ulcer healing and reduced chance of ulcer relapse. The drugs employed for anti-H. pylori therapy include the following except, that is ciprofloxacin. The following is true of anti-H. pylori therapy except it is contraindicated in all patients of peptic ulcer. The preferred regimen for preventing duodenal ulcer relapse is maintenance H2 blocker regimen. The most dependable emetic used to expel ingested poisons is intramuscular apomorphine. In a conscious patient of poisoning, use of an emetic is permissible in case the ingested poison is ferrous sulfate. The most effective anti-motion sickness drug suitable for short brisk journeys is cinnarizine. In case of hill journey, anti-motion sickness drugs are best administered at 12 hours before commencing journey. Chlorpromazine and its congeners suppress vomiting of the following etiologies except motion sickness. Choose the phenothiazine compound which has selective labyrinthine suppressant action, is used for vomiting and vertigo but not in schizophrenia, that is prochlorperazine. Metoclopramide has the following actions except increases tone of pyloric sphincter. Metoclopramide blocks apomorphine induced vomiting, produces muscle dystonias and increases prophylactic release, indicates that it has anti-dopaminergic action. Activation of the following type of receptors present on myenteric neurons by metoclopramide is primarily responsible for enhanced acetylcholine release, improving gastric motility, that is serotonergic 5-HT4. Okay. Select the prokinetic antiemetic drug which at relatively higher doses blocks both dopamine D2 as well as 5-HT3 receptors and enhances acetylcholine release from myenteric neurons, that is metoclopramide. Which prokinetic drug produces extrapyramidal side effects, that is metoclopramide. The progastrokinetic action of the following drug is attenuated by atropine, that is metoclopramide and cisapride. A patient returning from dinner party meets with road accident and has to be urgently operated upon under anesthesia. Which drug can be injected intramuscularly to hasten his gastric emptying, that is metoclopramide. Select the correct statement regarding the antiemetic efficacy of the three prokinetic drugs metoclopramide, domperidone and cisapride. That is metoclopramide is the most effective. Which antiemetic selectively blocks levodopa-induced vomiting without blocking its anti-Parkinsonism action, that is domperidone. The following prokinetic drug has been implicated in causing serious ventricular arrhythmias, particularly in patients concurrently receiving erythromycin or ketoconazole, that is cisapride. Indicate the drug which does not improve lower esophageal sphincter tone or prevent gastroesophageal reflux but is used as first-line treatment of gastroesophageal reflux disease, that is omeprazole.